here in the rollout for SHA. KHF is trying to facilitate that providers get as smooth a transition as possible. And in our attempt to do this, we are carrying out as many trainings as we possibly can with the SHA team, just to ensure that our providers are well taken care of in terms of access to knowledge. The aim is to improve access for our clients who are our patients, and we really hope that we are moving the needle on this. More importantly, for those of you who are in the WhatsApp group, please go back to the polls that we have put there that are requesting you give us information on one, access to the system, and two, access to the new upgrades that have been done. I am aware overnight a significant update has been pushed into the system, and that is a brief we will be receiving today from Joy Kiguta. I'm also awaiting Pius as well to join in on the call, and when he does as well, he will be useful in answering our queries and questions around some of the challenges you faced. This will be a technical session. We will try to keep it around about 1 hour long, so that we are able to go back to our other work, but also so that it is on the website and can easily be referenced by all of us. It will be on our KHF website. Martin, kindly just show where it will be on the chat so that members can access. Importantly as well, use the Q&A section on the webinar. Use the Q&A section on the webinar so that we are able to capture your questions. Normal conversations can go on chat so that you're able to capture the sentiments of actually what you are going through in your various facilities. KHF being a member organization, Martin will also put in details on how you can join. So please reach out on the email that Martin shall provide. That is admin@khf.co.ke if you would wish to be a member of KHF as well. That said, I will bring Joy to the floor so that she is able to walk us through the updates that have been done overnight. Karibuni na asante sana.
Thank you, Dr. Tim. Good morning, everyone. My name is Joy, and I'll be taking you through the SHA provider portal. There have been significant updates made on the portal, so I'll just take you through what the process looks like now once a patient comes to your facility. So allow me to share my screen, and then we can walk through the process. Sorry, I hope you're able to see my screen and you can clearly hear me. So what
Yes,
I'll do
we can
is...
see you. We can hear you. You were a bit louder yesterday. Yeah.
Okay, I'll see what to do with my audio. I'll speak louder.
Thank you.
So I'll just log out so that we can start the process together. Then I've seen a lot of the questions that are coming in the WhatsApp group is about credentials. If you have any concerns, just put them on the group and we'll have one of our colleagues reach out to you directly so that we can set you up quickly and get you using the system. So the URL, as I have previously been saying, is portal.sha.go.ke. And once you log in, once you put in the URL on your preferred browser, this is the landing page. In case you have any concerns or questions, please direct them to this phone number or this email address, and we'll receive the questions or concerns you have and we'll act on them immediately. So what you can also see here is also the SHA website. So if you click here, you'll be directed directly to the SHA website where you can be able to get more information in terms of registering individuals or members. onto SHA and what that process looks like. You'll also get to learn more about SHA. Now on the provider portal, what we are going to take you through is how to see a patient once they come to your facility. So the first thing to do is log in using the credentials that have been shared with you. So here you'll just quickly put your email address. Your email address and your password. In case you've forgotten your password, you can also reset it here. Then remember the contacts are found also down here. So the other thing, I have seen a lot of questions on the WhatsApp group is about the location bit. If you're having a challenge once you log in and you're being asked to select a location and there's no location popping up, just also write within the group and one of my colleagues will quickly reach out to you and we can resolve that as soon as possible. So in terms of what happens once you log in, the information that you see here is the name of the user who has been able to log in. In this case, since I'm using a test facility and test credentials, I'm able to see portal admin as the user and the name of the facility. Additionally, you can see the contact details for how you can reach out to us so that we can be able to help you out as fast as possible. Then the menu bar has not changed too much. What you can be able to see is the dashboard eligibility. Previously, this was known as visits, but we have changed it to claims. So this is where you should be able to claim from. Then the other thing is on the authorizations. So this gives you a report on any authorizations that have been done. And then we have pre-authorizations and such. These other bars will not be available to all front office users and will be rolled out as we move along. So I will take you through the process of what you should be able to see when a patient comes into your facility. So remember that the roles or what benefits, packages and sub-packages you see are dependent on the level of your facility. So remember that on my end, I'm using a test facility. So I will see all packages and sub-packages and interventions, but for your facility, you'll only see what you are supposed to see as a facility dependent on your CAF level. So let me search for myself. So you just enter the ID number as was the process before, and then you look up the member. So what we've been able to wire up is additional information that will help you in terms of seeing to make a call on whether the patient is paid up or not. So here, as previously, you're able to see the name, the ID number, and the validity. So once you click view, you can see the bio details as they were previously. Then the new addition that had been asked for and what we've been able to ship out is to show the eligibility of an individual or a patient to the Social Health Insurance Fund, so SHIF. So in this case, you see that Joy is not eligible. And the reason is because my premium assessment records have not been found. And what you are told as a solution or what you should inform a facility is to complete the profile and share assessment forms on Afya Yangu. So at this point, you can see that they are not. For example, if I was to come to your facility, you would see that I am not eligible for SHIF because I have not finished the assessment process. I will take you through the process for someone who has finished this process and what you should be able to see. So just give me a second, I pull another member. So this is another member. And this is, so the contribution information takes a few seconds to populate. So in this case, this is a client who should be declared by employers. So in this case, the employer has not provided the information for this particular member. So the solution is for the patient to inform their employer to submit the byproduct for eligibility processing. So this is just another example of someone who is not eligible and they are responsible. It is not a self-employed person, it's someone who is employed and their employer needs to give more information. Then I will take you through another one. So there are cases of individuals who prepaid through NHIF. So I'll take you through how that would look like in terms of the eligibility and the contribution status. So let me just pull one. So as usual, you'll see the bio details, and then you see now someone who had prepaid their NHIF and they are eligible. So this person had fully paid for NHIF, and so they should be able to be seen under the Social Health Insurance Fund. So you see the color is very green, and it shows you clearly that the patient or the member is eligible. And then you are able to see this is the contribution type as self-employed, and all records are complete. So those are the differences. So the first one was, for example, myself. I am not employed in this test instance, and I have not finished my assessment form, so that information cannot be pulled. Then the second one was where we had someone who is employed. They are not self-employed, they're employed, but their employer has not given the necessary information for them to proceed. So, and then this final one is for an individual who is self-employed and they had already prepaid on NHIF, or they have prepaid under SHA. So this information is just being pulled immediately. So that is one of the features that we were able to roll out last night, and you're able to clearly see who is able to access services. So now going back to myself as Joy, I am not eligible under SHIF, but I can still be seen under PHC. So I'll take you through that process. So you see this, I'm not eligible under SHIF, but I should be able to see things that are PHC only. If I was to click on something that was for SHIF, it would not populate because I do not have those benefits to enjoy, or I cannot be charged under those interventions. So let's say now I have come to a facility, a PHC facility, level 2 or 3, and I want to be seen under outpatient. So outpatient is my sub-benefit package. And then when I click on the interventions, I'm able to see the multiple interventions under the outpatient PHC sub-benefit package. The other thing we have been able to do is you can create, you can select multiple interventions. So we know, for example, if I was coming in to a facility and I wanted consultation, diagnosis, and treatment, perhaps I would need to also get some laboratory investigations done. So the facility can click the multiple interventions against which my visit will be started. So in this case, let's take the case of I've come for consultation, but I'll also go through the lab. So I can select the multiple interventions, in this case, consultation and lab, and against all these selected interventions, I can be able to start a visit. So remember previously in the previous trainings, I was telling you need to start a visit against each intervention. Now you're able to select multiple interventions and start a visit against them. Also note that the process is the same as for inpatient or any other level of facility. I'm just using this as a test case so that you can be able to walk through the process. Then now on this page, you're able to see the selected interventions and the access point. And you're also able to see that whether they require pre-authorization or not. So in this case, my consultation and lab investigations are the interventions that have been chosen by the facility for me to start a visit against. Remember, there are multiple ways to start a visit. So you have the one-time PIN, and then the other one is the pair authorization, or what we were previously calling the SHA authorization. And then the last one, which we're going to roll out in the coming days, is how to authorize via biometrics. So for now, we'll use my registered contact to authenticate. So you just click use to authenticate, and then a one-time PIN is sent to the patient. So let me just get my one-time PIN. So the patient should get a one-time PIN from SHA portal. So for me, it reads, Dear Joy, your SHA OTP is 1567. So verify that one-time PIN as a facility. Remember, the red bar at the top shows you the progress. So now you've been able to start a visit against multiple interventions. The other thing that we are working on is how to create a claim. So the claims, since we have different interventions that we have selected, claims will be submitted as a whole, as one claim, but you can bill for the individual interventions. So for example, you'll have one invoice number 1456, for example, as the invoice number, and then you'll have the different interventions showing here. So for each of them, remember I'm using a test provider. For each of them, you can be able to add the ICD-11 code. So you can either add that via adding a name. You can search for it by adding a name. So search with the name, or you can search with the ICD-11 code. Then if there was any other documentation, you're able to attach it. So here it tells you what is necessary. So you need to add bill items and add an invoice number. My team is looking at this error that you can see on my test provider, so I'll not be able to complete the process. But that is how you submit a claim. So you add all the necessary information, the invoice number, the diagnosis. Then if there are any other details that you'd like to add, like any other attachments, if there's a claim form, there's an invoice, there's any other documentation you'd like to add, you add them on this claiming bit. The process is similar to what is being used on the private insurance side, but it is tailor-made now for SHA based on the interventions and not just a blanket billing. So in short, what I've been able to take you through is the new changes. So how you're able to see the contribution status. And what action you should inform your patient to take in case the information is not complete. So here, when you search for me, for example, can be able to see my eligibility. I'm not eligible because I've not finished my profile on the SHA assessment forms. If you have a patient, let me show you the other instances I had taken you through earlier on. So we'll take the sample of someone who had prepaid the NHIF, or they've already started making contributions to SHA, what it looks like. So this individual has already prepaid. So you're able to clearly see that they are eligible under SHIF. And if I was to start a visit, if I was to look for the interventions against them, I would be able to start a visit against the SHIF fund, because here you can clearly see which funds are can be used. Then the other one is for someone who is employed. Someone who are, for people who are declared by their employers, how it looks like. So when you click view, when you search them and click view, so in this case, the employer has not submitted the necessary information for eligibility processing. So this individual should reach out to the employer for further guidance. I think I have a case where the employer has submitted all necessary information. Let me just check. Yeah, this is the same. So the employer has not submitted the necessary information. Yeah, so those are the new features. So seeing the clear eligibility information and whether someone is eligible or not, or active or not. And also being able to bill against multiple interventions and starting a visit against multiple interventions. So taking the case of outpatient PHC, which is the only thing I'm entitled to if I view the interventions, I can take multiple interventions. So let's say screening for common health conditions and maybe also prescribed lab. So I can start a visit against multiple of them, as opposed to starting a visit individually for each of them, as was the process previously. Then authenticating via the OTP or the SHA authorization, and also being able to see what interventions have been selected and what you want to start a visit against. The payer authorization process is still the same. So in case someone who has come in and they're not able to be, they cannot provide their OTP or something. So being able to start a SHA authorized visit, and then attaching the necessary documentation. And then you start the visit against this. So now on the claiming bit, you can come to this page where you can be able to complete any information, the one that I was taking you through previously of adding the bill items and the diagnosis against the interventions chosen. So here are the different interventions. And then you can add the bill items, the invoice number, and also the ICD-11 code. Then in terms of reporting, you can see all authorizations here. So all authorizations that have been made, you are able to see the information here and be able to export. So for now, the process still holds that we, for all packages and sub-packages, pre-authorization is not required, but we'll take you through the pre-auth form in a later training session, but you can now be able to claim against any authorization that has been started, and you can see whether someone is eligible or not. Dr. Tim, I'm done.
Thank you, Joy. Karibu sana Kamau as well from SHA. I think thank you for taking us through that session. Of important right now is we try and see what kind of questions we have in the Q&A, and I will request we go through those together so that we answer them. Joy and Kamau, you can take us through these so that members are fully brought up to speed. Karibuni. So once a contributor receives an SMS that their details have been transferred to SHA from SHIF, is there any other action required? Noting they had the NHIF number and card, how do they get to know their new details? How do they get to know their new details? Come on.
Thank you very much. My name is Pius Kamau from SHA. Now, they can log into the Afyango, they'll be able to see that their account the data has been moved to the new system. Then from there on, they can continue whether it's updating the dependents or if it's just doing the PMT. Yeah. Thank you.
All right. Employed sector is ineligible because their byproduct cannot be fetched. Does this mean they will never be able to receive service through this month? Address this. The byproduct for employed sector is ineligible. Sorry, the employed sector cannot see their byproduct. Kamau?
Okay, at the moment we're using both systems to verify members. So we can still use the NHF, the old NHF system to verify if they are up to date. And then the hospital can proceed with giving the services as the byproduct is being sorted from this other side. Thank you.
All right, so your answer is that we use the HICS system.
Yes, for verification, there was a communication
Okay.
shared to all hospitals on the same.
All right, sir.
Okay.
So for verification and member identification, we're using HICS. All right. Joy, we are still having location problems. Login credentials are asking for location. And I've also seen on the chat that Equity Afia Homa Bay are also having a location problem.
For those ones, kindly, if you put them in the WhatsApp group, we're sorting them as within 2 minutes. So just post them there, and then we'll
So
sort it.
anyone with a location problem, kindly do so in the WhatsApp group for providers, and Joy and her team will pick that up quickly. How does the employer provide details required for their employees? How does an employer provide details required for their employees? Come out.
That is with regards to monthly byproducts.
I suppose, yeah.
Okay, so there was a indication again to all employers how contributions will be done this month. So there was a way they're supposed to send contributions up to a 9th to go to the same way they were doing. Then from I think 10th they were supposed to send actually to SHA accounts.
All right, thank you. There's a simulation request here, Joy, for around an example, assuming the person visiting the facility is a beneficiary. So we will do this maybe in the last 5 minutes of our presentation once we are done with the questions. There is also someone saying that their location. So for location problems, please go to the group for us to be able to assist. I do indeed know that the group could be full, but we are requesting that tuelewane kidogo. We will open a second one on this front. Can we get assist allocation? That's another location for RFH. Are we going to submit claims online or physically? That's from Enoch. Kamau?
Okay, and SHA, the process will be digital, fully digital, so we don't expect any manual claims. But during this transition period, there was a communication issued on 4th, that is this week, regarding claims. So for facilities which are still not yet fully on board in the provider portal, then they may use HICS to verify patients. And again, we even shared a claim form, which I believe was shared to all hospitals. Maybe they can confirm if all hospitals received the claim forms, the ones that are here. Then, so for during the transition, for those who are still having challenges with the system, there's a claim form which was shared, and they can use HICS for verification. as they get on board, as they get onboarded into the provider portal. Thank you. Over.
All right, thank you. The other one was on, just take them as we go. The other clarification I have around this is that the system is generating a reference number, and Joy can confirm this. And this is the reference number that for the manual bit of the claim we shall use to submit. Claims are going to get preferential, the claims for this season are going to get preferential payment at the end of the month, so that we do not lose the memory of the season while handling them. There's someone who's asking for login credentials. Christine Udundo, please fill in the form that had been supplied. Jed, want to confirm that the turnaround time is still less than 24 hours.
Yes, it is.
All right, sawa. Kindly clarify on rebates on private insurance clients. Are the rebates amounts supposed to pick automatically based on the package or diagnosis you pick? On dialysis, is the amount supposed to be picked automatically? So clarify. This is from Jacob. I know the benefits package has been loaded onto the system. So the moment you click on it, the next step is authorization. I don't want to believe so, Joy and Kamau. And so they pick automatically. I hope I have answered that question correctly. Yeah. And Kamau and Joy, please confirm I have not seen my own things.
Yes. Maybe regarding
Okay.
insurance, what happens in the event the bill is more than what the daily rebate is? Then there's that aspect of co-payment, or the insurance, the other insurer can take up the other bit of the bill. Thank you.
All right. Tied to that, dear members, please rework your consent forms, yeah, because with SHA, what is going to happen to the population is we'll have a population that is highly sensitized to insurance, and it means that the health-seeking behavior may change a little. And with those changes, the attendant consequences, also medical legal issues will come up when it comes to copay and co-charging, meaning that your client must be made aware that they're ultimately responsible for the bill. And with this, SHA is only a third-party payer, but they remain ultimately responsible. So rework your consent forms to reflect this. And where a court charge or a copay is envisioned, please also let them know well in advance to reduce that medical legal exposure that would come with the new changes we are seeing. Simon Kangede is asking, I think, I don't want to believe this is chairman for COC. Facilities registered under COC, are they eligible or not? I sought clarification on this one, Simon, and the answer I got was that the KMPDC is the one that's responsible for registering facilities. The COC Act, in its word, in its letter, does not reflect this. However, regulations do have mentioned this. So we have requested for proper alignment for providers on this one from the ministry so that you can get good direction. That is the most recent answer I have. If I get something more and you're the person I believe you are, I will text you personally on the answer I get. SHA credentials, again, these ones you fill in the form and you will get your credentials. The turnaround time for this one is quite fast. How do you have a structured claim form? How do we add dependents? Do you have a structured claim form, and how do you add dependents? I think dependents are added when you register. Please don't forget to add dependents, and also please ask members as they register, add their dependents as well. On the structured claim form, There is one that is provided in the regulations for 2024, general regulations. I think I also saw it in the WhatsApp group. That is a claim form that has been gazetted. The feeling of members is that it's a bit cumbersome to deal with. However, it being an appendix to subsidiary law, I think we will need to have another one gazetted. So this is the one we are going to deal with for now. The portal does not allow us to enter diagnosis with name. Please try on training. This is from Sylvia. So Joy, we have two things we need to do. The one for the beneficiary and entering diagnosis by name. So please remember those. Yeah, so that the second also is also on diagnosis. For new facilities that were not initially accredited by NHIF after filling and signing the SHA contract, were we supposed to submit a facility banking form or how shall facilities payments be done? Considering the contract has no place for banking details. Kamau, this one is yours.
Well, that is very interesting. It seems somebody did not go through the entire contract. Anyway, there was a page that has banking details. But again, when it comes to banking details, we'll share a template on how they will share their banking details because we'll need their bank accounts, their KRA certificates, and that is KRA PIN certificates and others. So we'll have a communication done to the new facilities on how to submit their banking details. But there was a provision for that in the contract itself. Thank you. Over.
Right. I registered 2 visits yesterday, opening them today. I'm told they expired. I thought it was supposed to expire after 7 days. Joy?
We'll work on the expiry. Currently, it shows 48 hours, but let me take that up with the technical team.
All right. For level 4 and 6 patients that are supposed to be seen on referral, however, the system does not provide a referral tab. Is there a standard referral form for SHA? Kamau?
Well, let me get back to you on that. But let me get back to you on that. Sorry.
All right. What about the approved LOU under NHIF? Approved LOUs under NHIF. Kamau?
Okay, there was a communication regarding operations under NHF, and and there was a circular shared on the same on how to handle patients during the transition. So that includes even LOUs and claims arising from that period. So anything that has been submitted, anything that was incurred up to 30th September, will still go through the usual process of claiming and settlements. Thank you.
Joy, it's Emilia is asking, please select to Joy, please test selecting SHIF for employed, not eligible, but verified on HICS to confirm next claim steps on the portal. Joy, is that clear?
I understand the question, but I need to check if they are not eligible on the SHA portal, if you should be able to submit the claim on the SHA portal if you've confirmed on HICS. So let me confirm that, and then I can circulate a response.
Right. There's a question to repeat on how to submit the byproduct as well. All right. There's also a request that you walk them through the inpatient section. I hope you're noting them down, Joy, for inpatient section. Please note that down as well, so that maybe in a few minutes we get Joy to do that for us. For patients who may pass on, how is a logout done? For patients who may pass on, how is a logout done? Joy?
For now, we don't have a logout process. We'll need to take that as feedback to the technical team in case someone passes on.
Okay, thank you for that answer. ID search shows did not match any record. What does that mean? From Judith Chepkoech, the ID does not match any records. What does that mean?
They have
Joy?
not registered, so you'd advise the patient or the member to dial *147# and start the registration process.
There's also a request to take them through admission process for level 4 facilities. If a patient is seen as an outpatient, straight but not a referral. So if I will begin to answer this question, if it's not a select facility for capitation, then an out-of-pocket expense crystallizes in such an instance. If there is an inpatient procedure to be done, then you go ahead with the procedure as per the SHA benefits package. But in terms of how that behaves on the system, Joy, would you have any answers for that?
So for level, so you only see what services or interventions you are eligible to give. So if you're a level 4 facility and you're not eligible to give outpatient interventions, then you would not have that. So you just start from the inpatient process. The referral bit will come in later iterations.
All right. The other request is to have a simpler claim form. On that one, I do indeed agree with you. Again, for dialysis patients, kindly clarify whether it is still a manual process at the moment, or seeing them, or you're seeing them on the SHA portal. I believe that is a question for dialysis.
I can demonstrate the dialysis case.
Okay, so I think now we proceed to the demonstrations that Joy is supposed to do for us. I think there are about 4 of them. Tumruhusu atufanyie, kisha baada ya hapo funge mkutano. For the questions that have been asked, I have noted them down. I will transmit them to SHA leadership. And once I have the answers, I will get them, each and every one of us, one through the KHF platforms and also on the KHF website. Martin will upload them there, and to your respective associations if you do indeed belong to an association. Asante Joy, take it away.
All right. Just give me a second, I share my screen. So I'll just search for myself once again and take you through what you should be able to do for an inpatient case, for a dialysis case. And then show you also how you can attach documentation for the payer authorizations. So just give me a second. So I've searched myself here and I click view. So I've been able to, so here I'm not eligible, but for the purpose of this demonstration, I have asked to be able to show you how shift-only package would work, for example, for inpatient. Or let me start renal care services, which is a benefit package. So you can view, I can't view. My bypass has not worked. So yes, it's a SHIP only thing, so I should not be able to access it. Renal care. Let me see something else. Inpatient. Gosh. I should get a test patient who can be able to access. Just give me a second. I pick one. So let me say renal care inpatient. Yeah, so renal care inpatient, for example, someone has come for hemodialysis as an inpatient case. So I've seen the benefits, and now I am at the intervention stage. As I said, you're able to offer services without pre-authorization. This is something that will change as the rules get shared with us on who needs pre-authorization and who doesn't. So those will be added onto the platform. For now, the rules have not been shared specifically. So taking the case of someone who's come for hemodialysis at this facility, I can be able to start a visit or admit them against this intervention. So as you can see, hemodialysis is a fee for service, so you'll be able to bill for that. And I'll use one-time PIN, or I can use pay authorization since there was the request to see what supporting document is needed. So in the case, for example, a one-time PIN is not working or it's an emergency, you can be able to request for SHA authorization or pay authorization, and also write a note. Let's say not the patient is not able to be registered, to authorize their visit, for example. So here, the supporting document you should provide is their patient's ID card. If that is not available, then you can put a report or something. If someone came and they were unconscious, but you have a report that captures that information, you can attach it here as supporting documents. So I'll add my dummy patient ID, and I'll be able to start a visit against it. And at this point, the patient will be admitted. All right, let's take the case of, what else was asked for? So I've taken care of renal, and that renal case was inpatient. Assuming it was outpatient, I'm not able to, let's see if I can get renal care outpatient. I should be able to start a visit the same way. So select the particular interventions that you're going to be giving to the patient. You can see the access point is OP. So select the multiple interventions, and then you can start a visit. You can start via OTP. So I'll request for an OTP, which will be sent to my phone. So this is coming. So it has arrived, and my OTP is 151.67. Or something I didn't mention is, for example, for the inpatient visit that I started for renal, the patient gets an SMS about the admission, and also for any payer authorization, the patient also gets an SMS that a request has been made against the certain facility to send an authorization. So that is also given. Then the other question was diagnosis. You're not able to add a diagnosis by name. So you can be able to add a diagnosis and you save it. And that diagnosis is saved, sorry. So the other things in terms of billing, you'll be able to add one by one. The diagnosis does work, and it's working for whether you will search by add by name or add by ICD-11 code. Then the other thing I was asked to show is what is the process for a dependent. So let me just pick a sample member with dependents, a test user, and how you can navigate to the dependents. So this test user has dependents, loading the contribution status, which will be, we'll just show you the information I was showing previously. You can see the packages, and then the dependents are here. So if you want to start a visit against a dependent, you need to search for the principal first, and then you get to the dependent screen. Then you'll also see the eligibility. You will have the name. In this case, the name is dependent 3 user, so dependent is not eligible. They can only use PHC, for example. So view the interventions against a certain sub-package, and then you can select the interventions where you want to start the visit. So it's the same process, but for a dependent, you'll need to start from the principal, get the ID number, and then search against that. And then you can start the visit same way. Then in terms of authorization, so we do have guardian authorization and the pair authorization. So for the guardian authorization, what happens is you can use the one-time PIN. You can send a one-time PIN to the guardian in the policy. So for example, for me, if I was to take my child to hospital, you'd search for me, Joy, using my ID number on the eligibility screen, go to the dependents tab, which I had taken you through. Then you click the interventions, then start a visit. Then to start a visit, a one-time PIN will be sent. To start a visit for my child, you'll select guardian authorization, and then a one-time PIN will be sent to the parent or the principal within that cover or within that setup. So a one-time PIN will be sent to the parent, and then you can be able to add that information here. So you choose which one you're going to use. If they're multiple, then you enter the one-time PIN and verify, and the process will just be as for a normal individual. I think I have captured most of the questions. I think all of the questions that have been raised.
Indeed, you have Joy, and thank you for that. I can see quite a number of questions as well, still going on in the Q&A part. I have taken them just like I had said I did yesterday. I will push for fast tracking of the answers from our colleagues at SHA. That being said, Joy, when can we next reconvene for some of this? Do we do today in the afternoon?
Yes, we can have another session today in the afternoon around 3 or 4. I can get back to you on the exact timings.
All right. So today in the afternoon, we shall have a second session on the current upgrades and updates that we are seeing in the system. And hopefully get to make this a better experience. SHA is ultimately responsible for the rollout. KHF is facilitating the process, especially on the provider side and provider engagement. And we remain appreciative for your patience and the engagement you have so far given us. This webinar will be available to us on the KHF website. So please go in there and have a second listen should that be necessary. Alert your colleagues and friends on the same so that anyone who may have missed this webinar or meeting rather is able to go through that. To the 400 and I think 80 of us who've been in this meeting today receive my sincere appreciation. Joy and Pius from SHA, asanteni sana, and Martin, who has ably handled the back end of this webinar and is part of my team. Asante sana. Do have yourselves a good rest of the day. We shall catch up in the afternoon. Thank you.
Thank you.